Good morning, Senator Claxton.
Good morning, Representative Connor.
I hope somebody will tell me if they can hear my wife, who's out on the back deck reliving her early days listening to 80s rock music. If you hear it over mic, please let me know and I will make accommodations.
That's all right. I enjoy 80s rock music, Representative Connor.
I was going to say, I wish that was early days for me. Maybe she could pipe some in. That would feel really good. Maybe we could have an official HHS playlist.
That would be a very wide-ranging music genre.
What makes you think someone hasn't already done that?
All right. So welcome, everybody. This is the Health and Human Services Committee. We're meeting to continue consideration of the governor's change package. We went through roughly half of it yesterday, and we'll plan to conclude that today. We also have 4 bills to consider. There's a possibility that we'll get to those this afternoon, but as of now, they're scheduled for tomorrow morning, that we work on those starting at 10. Let's go around the table, the virtual table, and have folks introduce themselves. Let's start with Representative Connor.
Thank you, Mr. Chair. Good morning, everyone. My name is John Connor. I represent House District 58, which is part of Lewiston.
Representative Craven.
Thank you, Mr. Chair. Good morning. I'm Margaret Craven, and I represent House District 59, which is also part of Lewiston.
Representative Madigan.
Good morning. I'm Colleen Madigan. I represent House District 110, which is part of Waterville and part of Oakland.
Did I see Representative Javner here? Yes, there she is.
Good morning. I'm about to make your day, Senator Claxton.
All right.
I'm Representative Kathy Javner, and I proudly represent House District 141, which includes the towns of Alexander, Burlington, Chester, Cooper, Crawford, Danforth, Dennysville, Lakeville, Lee, Lowell, Mattawamkeag, Medibemps, Princeton, Springfield, Talmadge, Topsfield, Vanceboro, Waite, Wynne, Carroll, Codyville, Drew, Grand Stream, Webster, Barry, Cathants, Edmonds, Marion, Big Lake, Brookton, Forest City, Greenlaw Chopping, Cassuth, Lambert Lake, Kingman, Prentice, Twombly Ridge, and Whitney.
Drop the mic. Thank you, Representative Javner. We get to hear that about once a session. So that's a box we need to check off. All right, Representative Zager.
Thank you, Mr. Chair. Well done, Representative Javner. My name is Sam Zager. I am honored to represent District 41 in Portland, representing the neighborhoods of Deering Center, Deering Highlands, Woodford's Corner, Libbytown, Oakdale, Rosemont, and the UMaine Law School.
Representative Melaragno, welcome.
Good morning, everyone. My name is Gina Melaragno. I represent House District 62, which is part of Auburn. Happy to join you in HHS today.
Representative Stover.
Good morning. My name is Holly Stover. I represent House District 89, including the towns of Boothbay Harbor, Southport, Edgecombe, West Port Island, and part of South Bristol.
Senator Baldacci.
Good morning. It's hard to top all these great introductions. I want to welcome. It's nice to see Representative Javner as well as Representative Malarno. And I was wondering where Cassuth fitted into whose district, but I'm glad you clarified that. So I represent Bangor, which is the home of Paul Bunyan and is a great place to start a small business, and it's welcoming to people, and also the town of Herman, which is also a great place for small business. So good morning, everyone.
Representative Perry.
Thank you. I'm Ann Perry. I represent House District 140, which includes the communities of Indian Township, Baileyville, Bering, Calais, Charlotte, Robbinston, Perry, Pembroke, and Pleasant Point. And I will say where I'm from is the Far East.
Representative Griffin.
Good morning. My name is Abigail Griffin. I represent House District 102, which is Glenburn, Levant, and Cadescade.
Senator Moore.
Good morning. I'm Marianne Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, and Sullivan in Hancock County.
Representative Meyer.
Thank you, Mr. Chair. I'm Representative Michelle Meyer, serving Southern Maine's House District 2, which is Elliott and parts of Kittery and South Berwick.
And I'm Ned Claxton. I represent Senate District 20, which consists of Auburn, Minot, Mechanic Falls, Poland, and New Gloucester. If you also want to watch this presentation, you can go to legislature.maine.gov, look under committees for Health and Human Services. And on the upper right-hand corner, there's a YouTube link, should you care to watch as well. All of our prior committee meetings have been recorded and are available there. We also have a number of guests from the department, but before that, we'll introduce the people from who are our support staff, starting with Erin Dooling.
Good morning. My name is Erin Dooling. I'm one of the 2 nonpartisan legislative analysts with the Office of Policy and Legal Analysis.
And Anna Broom.
Hi, I'm Anna Broom, and I'm the other one.
And Carrie Withy.
Good morning. My name is Carrie Withy, and I'm the clerk for the Health and Human Services Committee.
The guests I referenced, let's start with Deputy Commissioner Mann.
Good morning, everyone. Deputy Commissioner Benjamin Mann, Department of Health and Human Services.
Jeff Wiley.
Good morning, Jeff Wiley, the Budget Director for the Department of Health and Human Services.
And Molly Bogart.
Sure, and I'm Molly Bogart, Director of Government Relations for DHHS.
And the person responsible for orchestrating yesterday and a chunk of today is Luke Lazur.
Good morning. I'm Luke Lazur. I am one of 1 analyst from the Office of Fiscal and Program Review.
But he is our analyst and does amazing work. And we are appreciative of the fact that you did some pruning on the 71-page document we did have, and it's now down to 40 pages. So thank you for that, Luke. That helped a lot.
Very welcome.
Any pressing matters to take care of before we get started?
No, but I just want to point out that Michelle Probert is here as well.
Oh, I didn't. Oh, she's on another screen. We never have 2 screens. There. Welcome, Director Probert.
Thank you. Michelle Probert, Manco Director.
There we go. Okay. So Luke, we turn it over to you and the annotated revised version of the change package.
Great. So on the change package that I sent you this morning, which is trimmed down a little bit, we're starting on page 72. There are 3 items on page 72. There are 3 positions, 2 public service manager, 3 positions, one of them to be the health information technology coordinator, 1 to be the director of program implementation, and also a public service coordinator 2 position, also in the Department of Health and Human Services Central Operations.
Senator Moore.
Thank you, Senator Claxton. I was just trying to think how best we could go about doing this voting process here. And in looking at, for example, on page 72 and 73, they fall under the code 0142 for that department. So what are the thoughts of maybe perhaps entertaining a motion that I would move all 4 of those items into the budget itself?
If that would work well for the committee, that would be fine. We can do what we want in terms of organizing, and I just need to reshuffle my pages to get them in the right order. So I'm good now. So you're talking about moving in or talking about a motion on 0142.
Now it'd be pages 72 and 73 of what our modified package.
So before we have that conversation, is everybody okay with that approach? To just sort of do it by cost center? Okay, so I see a lot of nodding heads. Does that work for you, Anna, as you try to keep up with this stuff? Yeah, okay. So thank you for that suggestion, Senator Moore. Representative Perry.
I second that motion.
Okay. I'm not sure it needs to be done as a form of motion, but all those in favor of the Moore method, please show your hand. Okay, so we'll go with that. That's unanimous of those voting and present. All right. So I'll entertain a motion then, or additional discussion on 0142 as the committee sees fit. Representative Craven.
Thank you, Mr. Chair. I move that we move page 73, 72 and 73 into the budget.
So all of the items related to 0142 on page 72 and 73. Is there a second for that?
Second.
Moved and seconded. Additional discussion? Not seeing any. Carrie, we'll ask you to run the tally on the vote. The vote being to move in pages 72 and 73 into the change package.
Representative Zager.
Yes.
Representative Zager. Yes. Representative Malorano.
Yes.
Representative Malorano. Yes. Representative Stover.
Yes.
Representative Stover. Yes. Senator Baldacci.
Yes.
Senator Baldacci. Yes. Representative Perry.
Yes.
Representative Perry. Yes. Representative Griffin.
Yes.
Representative Griffin. Yes. Representative Connor.
Yes.
Representative Connor. Yes. Representative Craven.
Yes.
Representative Craven. Yes. Representative Madigan.
Yes.
Representative Madigan. Yes. Representative Javner.
Yes.
Representative Javner. Yes. Senator Moore.
Yes.
Senator Moore. Yes. Representative Meyer.
Yes.
Representative Meyer. Yes. Senator Claxton.
Yes.
Senator Claxton. Yes. That's 13 yes.
Okay. So that would take us, Luke, to the next page.
The next page, which is page 76 of the change package. And on this page, you've already voted one of the items out. So there's only the first item on the page, which is increasing funding rates for the family-centered homes and shared living providers. This particular item here is all general fund and account Z211 developmental services waiver. It's also on pages 78, 90, and 104. So though, just to give you an idea what those accounts are, page 78, the account is Z212 developmental services waiver supports. Page 90, the account is Z210 Medicaid services developmental services. And page 104 is account 0147 medical care services payments to providers.
Very good. Any questions about that? So Representative Perry. When you're unmuted, we'd be glad to hear your motion or your question. You still need to be unmuted.
On page here. Looking at this, I'm wondering if, because it's all in the same category of services, if we could actually pass all of those items at once, or does that get confusing?
If the committee is comfortable with that, it does involve different accounts. So that's a modification to the Moore method. But we could certainly roll those up together if you wanted to.
It's related to the same program, and I guess
Yes.
looking at that as a whole.
Yep. So let's make sure we look at 78. Luke includes the top initiative, which is funding in year 2,
Yes.
section 21 and 29. Under a different account number. That's the Z112. And on page 90.
On page 90, it's the third initiative.
Thank you.
That's an other special revenue fund allocation.
And that's a slightly different account number, Z210. Okay. And then the last one is 104.
On page 104, it is the fourth initiative. And that's all federal expenditures fund.
We already
allocation.
voted on, yeah, we already voted on that one, correct?
No, the one you voted on 104 is the one below that, the dedicated tax accounts.
But I thought we voted on the federal expenditures funds as well.
No,
Only
no, no,
if they
no.
were-
We
yeah.
voted on items that only were federal.
Gotcha.
Yes. Yeah.
Okay, thank you.
So
Gotcha.
so you're referencing the third or the fourth, I'm sorry, fourth item. Okay.
Yeah.
On page 104, the fourth initiative.
Yes.
Okay, so that's the range of the bills related to section 21. I mean, sorry, the change package related to 21 and 22. I'll entertain a motion. Representative Perry, off mute.
Yes, I would like to move the 4 items, initiatives that relate to the Family Center Home Program.
Second.
Moved and seconded. Is there additional conversation, discussion, questions about that? I'm not seeing any. So the motion on the floor is to approve all of those changes. And we'll ask Carrie to run the tally on that.
Representative Zager,
Yes.
Representative Zager, yes. Representative Melorano,
Yes.
Representative Melorano, yes. Representative Stover,
Yes.
Representative Stover, yes. Senator Baldacci,
Yes.
Senator Baldacci, yes. Representative Perry,
Yes.
Representative Perry, yes. Representative Griffin,
Yes.
Representative Griffin, yes. Representative Connor,
Yes.
Representative Connor, yes. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan,
Yes.
Representative Madigan, yes. Representative Javner,
Yes.
Representative Javner, yes. Senator Moore,
Yes.
Senator Moore, yes. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes. That's 13 yes.
Okay. Next, Luke.
Next, we're on to page 79. And page 79 is adding in the account disproportionate share Dorothea Dix Psychiatric Center, which is account Z225. And this first initiative establishes an emergency response training coordinator. You'll see here that this is general fund funding that nets to zero as the personal services increase is offset by a decrease in all other. There is a corresponding transaction on page 81 in the Dorothea Dix Psychiatric Center account Z222, and that also offsets to zero other special revenue fund changes due to the increase in personal services being offset by all other.
Very good. Thank you. So yes, Senator Baldacci.
Thank you, Mr. Chairman. I would move for approval the items under Dorothea Dix Psychiatric Center, Z222, that are on pages, I believe, 79, 80, and 133. Is that correct? And 81.
That's the second initiative on this, on page 79, right?
Yeah, I was going to ask to approve all the initiatives regarding Dorothea Dix. It's
Okay, so let's go to page 80 and make sure everybody's okay with that.
So just to be clear, because there's a little bit of, shall we say, cross-pollination here, because the second item on the page that we were currently on page 79, that it has a management analyst 2 position. This one is shared with Riverview. So there's also some funding in the Riverview account, which is both on page 80 and I believe page 133 is also Riverview.
So let's stick with the first initiative on that page. Are you all right with that, Senator Baldacci?
Yes.
The
that's
first
fine.
initiative related to the Emergency Response Training Coordinator.
Right. I would move to approve that.
And that position also is on page 81. So we can include page 79 and 81 in that motion.
Second.
And moved and seconded. Additional discussion? Ms. Carey?
Representative Zager,
Yes.
Representative Zager, yes. Representative Melarano,
Yes.
Representative Melarano, yes. Representative Stover,
Yes.
Representative Stover, yes. Senator Baldacci,
Yes.
Senator Baldacci, yes. Representative Perry,
Yes.
Representative Perry, yes. Representative Griffin,
Yes.
Representative Griffin, yes. Representative Connor,
Yes.
Representative Connor, yes. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan,
Yes.
Representative Madigan, yes. Representative Javner,
Yes.
Representative Javner, yes. Senator Moore,
Yes.
Senator Moore, yes. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes. That's 13 yes.
Thank you. So Senator Baldacci, to go to Dorothea Dix, are you moving that we take the initiative on page 79 and combine it with the ones on 80, 81, and 133?
Yes, Mr. Chairman. I would so move to have them included in the budget.
And I'll second the motion.
Very good. Representative Meyer.
Thank you, Mr. Chair. It is possible that we could do a show of hands on some of these initiatives that we're bundling together and aware that we're unanimous. Something to consider.
So if I'd be looking for a second from one of my Republican colleagues to tell me that we're on the same page.
I'm fine with that. I think I'll second that motion. Thank you,
Okay.
Representative Myers.
All right. So all those in favor of doing a show of hands when it's clear that we're likely to do this unanimously? We're all good with that. Okay, unanimous of those present. Okay, so in that vein, the motion on the floor is to approve some changes at Dorothea Dix that are noted on 79, 80, 81, and 133. All those in favor of moving those into the change package, please indicate with a show of your palm. And Representative Stover, are you voting? Now you are. Thank you. That's unanimous, all those present. Thank you. All right.
Thank you, Mr. Chairman. I just want to indicate that Dorothea Dix is an important part of our community up here and serves hundreds of people in Eastern Maine. So thank you very much.
Very good. Okay.
All right, so now we're on to page 83. This is a new item from the change package in the 4E foster care adoption assistance account, which is account 0137. This provides one-time funding for the increase in the number of children in foster care. In this account, there is a general fund appropriation in each year of the biennium of $737,486 with a corresponding federal expenditures fund allocation increase. There is also additionally on page 135, an additional general fund appropriation of $3,880,676 in each year of the biennium. And that is in account 0139, state-funded foster care adoption assistance.
Any questions about those two items? Representative Perry,
Could I move those two items in?
you can.
I move those two items.
There we go. Is there a second for that?
I'll second that.
Okay. Then sounds like it would be appropriate on this one to run the tally through Carrie or with a show of hands. I'm looking for some feedback. Senator Baldacci.
Yeah, I just had if we could, while we're talking about this in terms of, obviously it's disappointing to vote for increase in funding because of increased number of children in foster care, but it's obviously very necessary. Just adds to the, hopefully at some point we have a joint discussion with criminal justice or judiciary, whoever it is, about the child protection system. Thanks.
Mm-hmm. Thank you. Representative Connor.
Thank you, Mr. Chair. I apologize. I got distracted there for a second. Can you just remind me which initiative items we are voting on?
So we started on page 83.
Yep.
And the one item there corresponds with another item on 135. State-funded foster care adoption assistance, the top initiative.
Okay, thank you.
Those two as they relate to adoption and foster care.
I would say we could probably go with a show of hands for this vote.
Thank you for that clarification. Any other questions, comments before we vote? Very good. So all those in favor of moving the one initiative on page 83 and the top initiative on page 135 into the change package, please so indicate. Very good. Thank you very much. Unanimous of those voting.
Then next we move on to page 85. And you'll see that the top two items on this page have already been voted. We're in the Maine Center for Disease Control and Prevention account 0143. And at the bottom of page 85 is an initiative to establish 2 management analyst 2 positions. There is a general fund impact of $66,640 in year 1 and $69,518 in year 2, and a corresponding other special revenue funds allocation increase.
Any questions about the item on 85? I don't see any. So I'd entertain a motion from Senator Moore.
Actually, Senator Claxton, I had a question.
Oh, please.
I guess I'm just curious when we're adding 2 additional ones to the CDC, and I guess I was wondering, I felt like they had sufficient staffing already. So that's why I wasn't sure about the need for the additional 2 positions.
Does somebody want to speak to that related to the CDC? Yes, Deputy Commissioner.
Happy to. Thanks for that question, Senator Moore. I think context is important as well, just for awareness. Over the last decade, from January 2011 to March, or basically to today, the department has down 326 positions. That's basically 10% of the overall headcount was eliminated over the last decade. We've rebuilt some of that, but still are pursuing targeted investments in certain areas. This would support infrastructure at CDC, particularly around contracting. CDC uses a lot of federal grants, which translates into a lot of different contracts. And these two management analysts would help support the contracting work that CDC has been undertaking, which has increased significantly during the pandemic.
Thank you. Do you foresee that that's going to continue, that type of workload?
I do. We were pretty strategic in proposing limited period positions where it made sense and permanent positions elsewhere. I think a lot of the funding will have is able to be used over multiple years, and I think these irrespective of the pandemic, we would be proposing these positions. Almost 25% of the CDC positions were eliminated of those positions that I talked about before. So I think in addition to some of the positions that were voted on unanimously yesterday, like the epidemiologists, there's corresponding contracting work that goes along with all of that work. So this would, I do anticipate this going forward in perpetuity.
Representative Javner, did you have a question?
Thank you, Senator Claxton. I'm just wondering, Deputy Commissioner Mann, if you would please just restate how many positions the department has lost, but also with that, give us a number that you have already been reestablished in the department, please.
Sure. The number I cited before was 326, and actually 447 were eliminated from 2011 to 2019. So I'm doing the math. That was 121 under the Mills administration has been created newly across the department. We proposed several new initiatives, headcount initiatives in the original biennial budget, and this change package proposes several more.
Does that answer your question, Representative Javner?
Yes, thank you very much.
Okay. Senator Baldacci?
I just want to say as one committee member, I fully support the addition of these positions because we saw, from my perspective up here in Eastern Maine, the decimation of public health services. And I think in the middle of a pandemic, we're, in addition to normal public health challenges, that we need to beef up our public health resources in general. So I'm glad to see we're moving in that direction. Thank you.
Any comments, discussions, questions? And I'll entertain a motion on the initiative on page 85. Representative Craven.
Thank you, Mr. Chair. I move in the initiative on page 85.
And is there a second for that? Okay, Representative Perry. Thank you. So, Carrie, if you'd go ahead and do the vote.
Representative Zager.
Yes.
Representative Zager. Yes. Representative Melorano.
Yes.
Representative Melorano. Yes. Representative Stover.
Yes.
Representative Stover. Yes. Senator Baldacci.
Yes.
Senator Baldacci. Yes. Representative Perry.
Yes.
Representative Perry. Yes. Representative Griffin.
No.
Representative Griffin. No. Representative Connor.
No.
Representative Connor. No. Representative Craven.
Yes.
Representative Craven. Yes. Representative Madigan.
Yes.
Representative Madigan. Yes. Representative Javner.
No.
Representative Javner. No. Senator Moore.
No.
Senator Moore. No. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes. That's 9 yes, 4 no.
Okay, Luke.
All right, so we're on to page 86. This is the item in the main health insurance marketplace trust fund, account Z292, which was discussed a bit yesterday. This is an other special revenue funds allocation increase to get the allocation in line with the expected revenue in the coming years.
So this is revenue we expect to receive as the federal folks don't get it for the payments from the insurance
Yes.
companies, largely, yes. Senator Moore.
Yes, I would go ahead and make a motion to move this line into the change package.
Representative Perry.
I second.
Any further discussion? All those in favor of moving the item, the initiative on page 86 into the change package, please indicate. Very good. Unanimous of those present and voting. All righty.
And our next page is page 90. And there are 3 initiatives on this page. Let me change that. There are 2 initiatives left on this page to vote. The first one, this is an account, Medicaid Services, Developmental Services, account Z210. The first one provides funding to ensure main care services receive a cost of living adjustment. This is another special revenue fund allocation of $1.57 million in year 2 of the biennium. There is a corresponding item on page 101 that goes along with this, and that is in the medical care payment to provider account. And that, just trying to find the right one, that has a general fund impact of $8.4 million in year 2 of the biennium, and a federal expenditures fund allocation increase of $18.6 million in the second year of the biennium.
Any questions about those 2 cost of living adjustments? Then I take a motion. Representative Perry.
Yes, I would move the 2 cost of living adjustments in.
The item being on page 90 and page 101 related to cost of living. Is there a second for that?
Second.
Okay. Any further discussion? Although, can we do this with a hand vote? Then all those in favor of the cost of living adjustment being added in? Thank you. Unanimous of those voting. Thank you very much. So that gets us to the second item on page 90.
Which is still in the Medicaid Services Developmental Services account. And this provides funding to implement recommended rates from rate study of substance use disorder intensive outpatient program services. In this account, it's another special revenue fund allocation increase of just over $71,000 in year 1, just over $143,000 in year 2. And then on page 104, it's the second initiative on page 104. And this is in that account, which is the medical care payment to provider account. It is a $170,000 general fund increase in year 1 and a $340,000 general fund increase in year 2. And there's a corresponding federal expenditures fund allocation increase as well.
Any questions about that? Senator Moore.
No, I would just make the motion to go ahead and move those 2 items into the change package.
Is there a second?
I'll second.
Very good. So any other discussion? So if you're comfortable with that motion, items on 90 and page 104, please show approval. Thank you very much. All right. So that gets us then, Luke, to,
I think that finishes page 90. So then we move on to page 95. My system is a little more difficult, so bear with me as I make sure I'm on the right line. The first initiative, this is an amendment to a current initiative in the budget, and the revised initiative for the new intensive outpatient program for high acuity main care members changes the general fund appropriation from 410,000 to just over 467,000 in year one, and from 410,000 to 3.7 million in year two, with corresponding federal expenditure fund allocation changes as well. This is also on page 114, which is in account Z201 Mental Health Services Community Medicaid. There is a change to the other special revenue fund allocations that corresponds with this same change. On page 125, the program is Z202, the Office of Substance Abuse and Mental Health Services Medicaid seed. And that is a general fund change that corresponds with the change we saw on this page. That brings the totals to just over 530,000 in both years of the biennium. And the last one that goes along with this is on page 134 in account 0139, state funded foster care adoption assistance. That is also a general fund change that brings the total to 128,000 in each year of the biennium.
and as I recollect, the last two items, 125 and 134, did we deal with those in the delete process?
That may be, yes,
No,
that may be.
We didn't, Luke, because we knew that they were mixed up with this.
Okay, thank you. I hadn't scrolled through the pages, so
Yeah.
no, they are still there.
All right.
Thank you, Anna.
Thanks for keeping track of that, Anna. So we have these 4 pages, the last two which are removing prior work, and 2 that add revised work related to the intensive outpatient program. Yes, Senator Moore.
I would make a motion that we move the lines that are related to the intensive outpatient program as referenced into the change package.
Thank you.
Second.
There's a second for that. Thank you, Representative Craven. Any additional discussion? So all those who are comfortable with moving these items into the change package noted on pages 95, 114, 125, and 134, please so indicate. Very good. Thank you. All right.
So now we should be on page 96.
What about at the bottom of 95? Do we deal with the PNMI?
Not yet, Luke.
The bottom of page 95 is the current. So
oh, I'm sorry. Yes.
Really, the vote is on the revision, which is on the next page.
Thank you.
Yeah, the revisions get a little confusing.
Mm-hmm. Mm-hmm.
So as you said, the first one we'll be dealing with is a revision to the increase in rates to Section 97 Appendix D to meet the requirements of the Family First Prevention Services Act. So originally, there was only funding in general fund and federal expenditures funds, and the revision adds other special revenue. Additionally, the original had 0 funding in the first year. now there is funding added to the first year. And there was a change as well to the second year of the biennium's funding amounts. This is also on pages 107 and 109.
Can I just offer a point of clarity, because it's a little more complicated even than that, because there was funding proposed in fiscal 22. However, it was part of LD 715, the current chapter 29 that is currently law. So that has been passed, which is why it reflects 0 there. So there is funding for the PMIDs, and it's currently in place, and we are amending both fiscal 22 and 23 through this initiative.
Okay. So I'm a little behind here, 107. Okay. So are there 2 items on 107?
I'm trying now to find, I may have identified that one incorrectly, or I identified incorrectly on my other sheet. So I'm trying to, yeah, no, so there is an item also on page 109.
Yeah, okay.
So
They're both revisions. I think that's what's confusing you, Senator.
Yes, I just figured that out.
Yeah, it's not that there's 2, it's just that there's a current and a revised.
Right. Thank you. You were right. Okay. Representative Perry.
Yes, I would like to move items regarding the main benefits manual 3 and regarding reimbursement of child care facilities including 96, 105 and 107.
107.
It's 107 and 109.
Oh, 107 and 109. I'm doing well.
I'll second.
And there's a moved and seconded. Thank you for that. Any discussion? All right. Those of you who are in favor of moving those items into the change package. Thank you. All right.
Okay. So then on page 96, sorry, let me get back to that page. This is definitely not as efficient as my normal process, but it is what we have.
Working well.
So the other initiative on page 96 that we're dealing with is also a revision to an amount that was originally proposed in the budget. This is one we discussed yesterday, where it was originally in the budget a reduction in funding for non-emergency transportation broker payments, and the revision actually makes it an increase in funding due to increased enrollment. So the general fund impact is that it goes from a reduction of $732,809 to a general fund appropriation increase of $967,089, and there is a corresponding federal expenditures fund allocation change that goes along with that.
So,
and lucky enough, this is only on this page.
Yeah. So those that swing is related to decreased utilization and increased subscription or participation. No?
I'll let Ben.
We assembled the budget last fall. We were scrubbing the budget diligently for any savings that we might be able to produce, given the fiscal situation of the state at that time, given the maintenance of effort requirement and our the fact that main care enrollment is up over 50,000 individuals since the start of the pandemic and will continue to increase. That was an inaccurate estimate on our part, and we have since are going to have increased costs related to transportation due to the increase in enrollment due to the MOE requirement for the duration of the public health emergency. So in an effort to find savings originally, it will not bear out here, and we will need to increase costs for transportation in fiscal 22.
Thank you for that. So I'll entertain a motion. Senator Moore.
Yes, I'll make that motion to move this into the change package.
I second that.
Thank you, Representative Craven, for the second. Any additional discussion? Very good. I think we can use a show of hands again. So all those in favor of moving this into the change package? Thank you. All right.
So now we're on page 97. And I'm just peeking back to make sure. Okay. So on page 97, there is another one that is being revised. The first one is revising the funding for the changes instituted for the main integrated health management system due to the correctly identifying family planning claims. The original had a deappropriation in the general fund of just over 1.2 million in both years of the biennium. But in the revision, it is a deappropriation of just over 490,000 in each year of the biennium. And the federal expenditures fund allocation is an increase of the exact same amount as what the deappropriation of the general fund is in both instances. This is only on this page, this one page 97.
Yes, Senator Moore.
Yes, I would go ahead and make a motion to move that into the change package as well.
Second.
Moved and seconded. Thank you. All right. Any additional discussion? Then we can vote by show of hands, those who want to move it into the change package. Representative Madigan, there we go. Thank you. All right. Unanimous. Very good.
Okay, the next item, the current is on the bottom of page 97, but the revision is on the top of page 98. And this was the item that reduces funding for savings achieved due to the 340B changes. In the original, there was a deappropriation in the first year of the biennium. The implementation of this has been delayed, so in the revision, there's no funding in the first year of the biennium. And the deappropriation in the second year of the biennium is the same as it was in the original proposal.
Senator Moore.
Yes, I would just like to bring up the fact that in the initial biennial budget, we actually unanimously voted to not move this into the budget. And I still feel just as strong. I understand that they are working on a reimbursement methodology, but it's not there yet. And I don't think I'm comfortable with taking this monies away from the physicians and the doctors as it is. So I'm still a no for this particular section.
Director Probert.
Hi, thank you. I just wanted to provide some clarification that CMS has been clear with the department that they expect us to make a reimbursement methodology change. We actually have a proposed change that CMS has given the green light on. This is really just giving us additional time to implement. We are one of, if not the last state in the country to implement this reimbursement methodology and don't see this as an option on our part.
And does this number that's in the revised version, does that correspond to the use of the approved methodology?
It does.
I would also just add that the providers that are being affected by this, many, if not several of them, are receiving a COLA through our proposals in the main care Part 2 budget, and hospitals also received a one-time supplemental payment in addition to an increase in their ongoing supplemental payments. FQHCs would also are also getting an annual rate adjustment, which we proposed as well.
Thank you, Deputy Mann. And I would also add, as we have been in regular communications with providers on this topic, there's also been acknowledgement that our plans of our rate system reforms in general, which includes doing in-depth rate studies of family planning, as well as family planning clinics, as well as hospital reimbursement that is planned for the biennium, and certainly plays a role in their overall reimbursement amounts as well.
Senator Baldacci.
I just had a question. So when you formally adopt that new methodology or reimbursement standards, would you be coming back to this committee for us to approve that, or how would that be done administratively?
We would do that through state plan amendment, as well as through adjustment to current rule, and 340B covered entities have agreements with the state, so we would be amending those agreements as well. But this initiative, as stated, does reflect the anticipated savings from implementing the reimbursement methodology change as of next July.
Okay, the only asked this as a question. It's just, why wouldn't we do this all at the same time when we're adopting the methodology, and then adjusting the funding at the same time? I'm just concerned that there would be a gap between the times we reduce funding versus the changes in the reimbursement. So is there going to be a gap in that period of time? Or?
Nope, it will be designed to align so that the authority will be effective at the same time that we adjust the funds.
Okay, that's very helpful. Thank you very much.
And in future years, it'd be anticipated that there would be a zero on this line because this is one-time savings. And then the payment methodology recalculates what the hospitals would get.
This one is not one-time savings. This is an ongoing change.
So that's ongoing versus the baseline budget. I'm sorry. Thank you. Yeah. Okay. So this is just built into the budget process until we revise the baseline budget. Okay.
This would adjust the baseline budget downward starting on July 1, 2022 and going forward, and unless there was other legislative action to subsequently adjust the baseline.
Right.
If it's helpful as a reminder, the reason why CMS looks for states to have a different methodology for 340B drugs is because providers who participate in the 340B drug program pay much less for these drugs. And yet currently we reimburse them the same as we do for any providers who are administering the drugs. And CMS generally requires that state have reimbursement methodologies that are efficient and align with costs. And so that's the basic underlying principle here.
And how does this figure compare with what the entities would pay for these medicines? Does this cover only cost, or does this include some allowance for administration or dispensing?
So the expectation is that we reimburse at an amount that approximates the acquisition cost by the providers. There are, for example, depending on what the drug is that's being administered, there may be an office visit cost that I would say in part covers the administration piece, but it would differ depending on what kind of drug we were speaking of.
And if it was a hospital, would they charge dispensing fees? If you went to a hospital-based pharmacy or a community pharmacy with a prescription, does Medicaid cover the prescription filling part of that for the pharmacist?
So to be clear, the Main Care 340B program only applies to physician-administered drugs and does not include pharmacies, either retail pharmacies or hospital pharmacies. So these are not the drugs that you're going to the pharmacy to pick up a prescription. This is in an office setting, generally speaking. And for those office settings, there aren't specific dispensing fees, but there are oftentimes, like I said, visit fees, et cetera, that are intended to cover associated costs.
Okay. We've added Maine Health Association and to our list of participants. Welcome, Mr. Austin, if I can, and also Lisa Harvey McPherson. So, Jeff, did you want to respond to the discussion you've been listening to?
Yeah, I appreciate you letting me in. I guess I have a question for Michelle. She's been working with my colleague David Winslow on this for several months. I guess my only question is that formal CMS approval? I had not heard that you had formal CMS approval of the methodology, or is that just sort of telephone conversation? You think you've worked it out and you think they're going to approve it. I guess I wasn't aware of that status step. So if I could just ask that question, I'd appreciate it.
Yep, thanks for that question, Mr. Austin. I did not mean to imply that it was formal CMS approval at this point. We have had ongoing conversations, as we often do, prior to official submission to make sure that we're on the right path. So we have had emails and conversations, but we have not submitted for formal authority at this point.
Okay. Yeah, because normally we would, we tend to provide written comments to CMS on changes that affect us. And I know we hadn't done that yet. So yeah, I mean, I guess we would say until something is approved, booking the savings appears to us to maybe be premature. Obviously, we know the work is ongoing. We know the CMS expectation is out there about states having methodologies, but until formally approved, booking the savings appears to us to be premature. But I appreciate being given the opportunity to comment.
Thank you. Lisa Harvey McPherson?
Yes, good morning, everyone. In addition to the feedback
Did you
from
just
Jeff,
want to briefly identify yourself?
Oh, Lisa Harvey McPherson with Northern Light Health. Can you hear me okay?
Yes, can, yes.
Okay, great. I just want to share a bit of a federal perspective. At the federal level, when they implemented reduction in payment for 340B drugs to more closely approximate the acquisition cost, they redistributed those savings into reimbursement adjustments for outpatient services. The state has the ability to do that also. If the state has been advised by CMS, they must implement a new methodology. There's no reason why it has to result in a payment reduction for provider outpatient services. They can simply redisperse those savings into adjusting the rates.
Thank you for that comment. I think there's an interest at this point in a brief caucus. So why don't we break until 11:30? And that'll give us a little bit more time maybe than we need, but we've been sitting for a bit. So if that's okay with everybody, we'll take a break until 11:30. Okay, we'll be back. Okay, I think we can resume our work. Consideration of the budget change package. When we left the conversation, we Senator Moore.
No, go ahead, Senator Claxton, finish your statement.
I was just going to say, we were on page 96, considering funding or savings related to 340B, the top of 96.
Actually, 98. But
I'm sorry. 98, yes.
so I would make the motion to not move this initiative in or this revision into the change package in view of all of the discussion that we had.
I would second that.
Motion's been moved and second. Is there additional discussion? Okay, then all of those who are in favor of not moving this into the change package, please indicate. Show of hands. I'm looking for everybody's hand. Very good. Thank you. All right, Luke, that should get us a little further down page 98.
Yes, so we're on to the second initiative on 98. That is, again, an amendment of something that's currently in the proposed budget. This was the item that reduces funding by developing a preferred drug list and prior authorization process for physician-administered drugs where there's a biosimilar equivalent. In the current budget, the impact was around $600,000 decrease each year in the general fund, with a corresponding federal expenditures fund allocation decrease. The revision changes that decrease to $343,989 in year one and $599,768 in year two, with a corresponding change to the federal expenditure funds allocation.
Any questions about that one? Yes, Representative Griffin? Nope, okay. Representative Perry?
Whoops. I'd like to move that in.
So there's been a motion. Is there a second?
I would second that.
There's a motion and a second. Is there any additional discussion of this particular item? Senator Moore?
I just wanted to point out that when we were going through the biennial budget before, we did unanimously approve this, the actual initiative itself. So it was a unanimous 13-0, just making that comment.
Thank you. Any other discussion? So the motion to move this into the budget has been moved and seconded. All those in favor of doing that again? That's a unanimous of those present. Thank you very much. All right.
So the next page we're going to move on to is page 101. And these are new initiatives in the change package in the medical care payment to provider account 0147. The first one on page 101 is provides funding to implement the recommendations of the Main Care Comprehensive Rate System Evaluation Report for dental rates. This has a general fund appropriation of $2,846,428 in year two of the biennium, with a corresponding federal expenditure fund allocation.
So
I will also note that I know that Molly Bogart with the department did send along some additional information about the dental rate increase.
Molly, if you're there, can you summarize that for us briefly?
Sure, and I might actually, I was handing it on from Director Probert, so I may ask her to do that.
Sure.
So it's a one pager, but it does include a rather complex table that fulfills the request from yesterday, Senator Claxton, for an estimate of percentage increase in rates per subcategory of dental services. I will note that these are estimates. I put a number of caveats there, but the table that I included is directly from our rate system evaluation interim report. There is a link on the PDF, but the data that is used is for benchmarking commercial median rates for Maine from 2019. We plan to update the year used for that data. The analysis is also limited to codes, which are the vast majority where there are commercial codes available for comparison, but there are some codes where we would need to develop an alternate benchmark. As an overall, I will share that it represents a 45% increase in spending. Looking at the codes where we have a comparison for dental services overall, the actual percentage varies quite a bit by subcategory. And I'll also note that, as I stated yesterday, there's a lot of variation in particular codes. And so you can see, while this is certainly a significant investment overall, there are individual codes that would essentially be rebalanced and decreased in certain categories.
Thank you for that. A significant change. Okay, so let's consider them one at a time then. The initiative on page 101. Any other thoughts or questions related to that? Then I would entertain a motion. Senator Moore.
I would make the motion to move this line into the change package. We definitely need to expand our dental provisions.
I would second that.
I'd love to have some idea of some way of measuring out-year savings over time, but so there's motion's been moved and seconded to move in the provision for an increase in dental rates. All those in favor, please show of hands. Very good. Thank you. Unanimous. Okay. And the second initiative relates to Maine maternal opioid misuse, the Maine Mom program. And as required per the federal grant. So that's to get us to an adequate threshold. Is that what that dollars are? Those dollars are?
I will say that as a part of the federal grant, this develops a new way of, or provides Maine Care reimbursement for a new model that will be statewide to deliver prenatal as well as postpartum and newborn care together with medication-assisted treatment and outpatient therapy to people with opioid use disorder as well as their children. So this, the federal grant helps us develop that and then provide some initial funding for the service, but it's an expectation of the grant from the outset that this be integrated into Maine Care coverage. And that is what this dollar amount does, is provides the funding for us to have this as a regular benefit.
Thank you, Director Probert. Are there any questions about that? Yes, Senator Representative Perry.
I would like to move that item in.
I'll second the motion.
Moved and seconded. Additional conversation, discussion. Then we can go with a show of hands for those in favor of moving it into the budget. Unanimous. Thank you. And
so back to page 101, the next initiative is the cost of living adjustment that we voted on. You voted on earlier. And so we're to the initiative at the bottom of page 101 provides funding for creation of value-based hospital supplemental payment sub-pool, which has a general fund impact of $168,562 in year one and $183,139 in year two, with corresponding federal expenditure fund and federal block grant fund allocation increases.
Any questions about this initiative? Representative Perry.
I would like to move that initiative in.
I'll second the motion.
Moved and seconded. Very good. No further discussion. Show of hands to move that into the change package. Very good. Unanimous. All
So
right.
now we're on to page 102. This is still in the medical care payment to provider account 0147. The first initiative on this page provides funding to establish a pilot program to provide reimbursement for structured recovery housing services that support parents with substance use disorder who are at risk of or currently involved with child protective services. This initiative has funding only in the second year of the biennium. The general fund appropriation is $74,520 with a corresponding federal expenditure fund allocation increase.
How do folks, yes, Representative Meyer. When you're off mute, please.
Sorry about that. Thank you, Mr. Chair. I would move this initiative into the budget.
Is there any interest in considering the whole page? Why don't we do all of 0147 on page 102?
Do we want Luke to go over those additional initiatives before we ask for a vote?
It's another pilot for substance use disordered parents struggling with that, and chronic homelessness, and the diabetes prevention program set up.
Okay, so I would amend my motion to include those initiatives as well.
Is there a second?
I'll second that.
Thank you. All right. Any other discussion? All those in favor of moving the four initiatives on page 102 into the change package? Very good. Unanimous.
All right, so then page 103 is a continuation of some more new initiatives in medical care payment provider account 0147. The first one establishes a pilot program under an 1115 substance use disorder Institute for Mental Disease exclusion waiver to provide reimbursement for skills development services that support parents with substance use disorder. Has a general fund appropriation of $95,400 in year one and $189,720 in year two, with a federal expenditure fund allocation increase corresponding to that.
So since this whole page also involves 0147, is there any interest in considering the whole page? Or do you want to? So I'll entertain a motion. Senator Moore?
I'll make that motion that we accept all of the items listed on page 103 and move them into the change package.
Second that.
And a seconded. Additional discussions? All those who are in favor of that motion, please so indicate. I'm not seeing Senator Baldacci. If you're there, I can't count your vote. So he had to step away, I think, too. So we'll count it as a 11. Thank you.
All right, then we're on to page 104, which is still a continuation of medical care payment to provider account 0147 new initiatives. There is one page at the bottom here that's been voted. There are two now that have been voted in on this page. Looking to see, there might actually be three. Yeah, there are three items now that have been voted in, so this will be a little more confusing. Let me start at the top. This one provides funding for a proposed 1115 Institute for Mental Disease Substance Use Disorder exclusion waiver. pilot to continue main care coverage for parents during the process of substance use disorder rehabilitation and reunification with their children. It's a general fund appropriation of $876,960 in year one and $1,753,920 in year two, with a corresponding federal expenditures fund allocation increase.
Do we want to look at the middle initiative, which is the first episode of psychosis at the same time? Okay. So then I'd entertain a motion to approve initiatives 1 and 3 on page 014, on page 104.
So moved.
Senator, I just wanted to step in that second initiative that has the course coordinated specialty care model for first episode of psychosis. There is another line that's associated with that on page 116. So I just didn't know if you want to also bring that in.
Thank you. Thank you. So if people are comfortable with that friendly amendment of rolling in 116, which is.
It's in account Z201 Mental Health Services Community Medicaid. And that is just another special revenue fund allocation increase that corresponds with the amounts we discussed on page 104.
Sure. And that's the top initiative. Thank you for catching that, Luke.
Not a problem.
So there's a motion that's been seconded to approve the initiatives 1 and 3 and the corresponding initiative on page 116.
So moved.
All and a second.
I'll second.
Thank you. All those in favor of moving those items into the change package? And again, we'll exclude Senator Baldacci. Okay.
Okay. Then we're on to page 105. And this is more initiatives in the medical care payment to provider account 0147. There is one item, the FMAP, the 6.2% FMAP increase that's been voted on this page. Everything else on this page has yet to be voted. The first item provides one-time funding to support hospitals in their response to the COVID-19 pandemic. This has a general fund appropriation of just under 5.4 million in year one only of the biennium, with a corresponding federal expenditures fund allocation increase.
So do we, yes, Representative Perry.
It looks like the second one on that does that as well for the non-PNMIs. So I would like to move both of those items in.
So you're talking about the first and the last initiatives on page 105?
Yes, I am.
Senator Moore?
I was going to actually make the motion to include all 3 of them.
Oh, okay.
We'll consider that a friendly amendment, if that's all right with Representative Perry.
Oh, yeah.
And then I'll second that. Thank you.
Okay. So the motion's been made to include the 3 unvoted initiatives on page 105. All those in favor of moving that in the change package? Very good.
Then we're on to page 106. This is the last item that is a new initiative in the medical care payment to provider account 0147. This is the one that provides funding in fiscal year 22-23 and ongoing. I did get in touch with the department to make sure that the funding for the services is an ongoing that begins in the second year of the biennium. And this is services for children under age 21 who would be otherwise eligible for federal benefits, but for their immigration status. There are also two other lines associated with this initiative that are in the first year of the biennium that are the technology changes required for this, and those items are just one time. And those other items are on page 119 and 123.
Mr.
Yes.
Lazar, I just wanted to clarify that in addition to children under age 21 through the CHIP unborn child option, this initiative does also provide coverage for pregnant individuals who would otherwise be eligible but for their immigration status. So I just wanted to add that clarification.
Thank you. Representative Perry?
Yeah, I would like to move in this item and the items on 96 and 99 that relate to that, and 109 that relate to that.
What, 119 and 123?
Right.
So everything associated with page 106.
Right.
Very good.
Yes.
Okay, thank you. Is there a second for that?
A second.
And there's a moved and seconded. Is there additional discussion or questions? Very good. So one,
Run the vote.
Carrie, you haven't had to do anything for a while. Do you want to tally a vote? I'm sure you haven't been doing anything except for the emails you've been sending like crazy.
Representative Zager.
Yes.
Representative Zager, yes. Representative Melorano. Representative Melorano is absent. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci. Senator Baldacci is absent. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
No.
Representative Griffin, no. Representative Connor.
No.
Representative Connor, no. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner.
No.
Representative Javner, no. Senator Moore.
No.
Senator Moore, no. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 7 yes, 4 no, 2 absent.
Okay.
So the next page was page 107, but we already voted on the initiative there up above. Then the page after that is 109. We voted for that up above. So the next page we need to worry about is page 111. This has 2 new initiatives in the Mental Health Services Children account Z206. The first one corresponds with an item on page 127 that transfers funding from the Office of Substance Abuse Mental Health Services Program, which is what's on page 127, General Fund, to the Mental Health Services Children Program General Fund, which is the account we're in now for youth and family substance use disorder agreements. And this has a corresponding general fund decrease in the other account that is the same as the increase in this account. So it's a net 0 to the general fund. It's just moving it between 2 accounts.
Yes, Senator Moore.
Yes, I also would have no problem addressing the second item on that page as well. So I would make the motion to move both items on page 111, as well as the corresponding one on page 127 into the budget.
Second.
Moved and seconded. I don't see any additional hands or discussion. So all those in favor of moving the two initiatives on 111 and the corresponding item on 127 into the budget, please show of hands. Very good. So excluding the two who are not present.
Okay, so next is page 112. This is an amendment to an item that's currently in the budget in the Mental Health Services Community account Z198. This provides funding to expand advocacy services for mental health clients receiving the community-based mental health services. The original line in the budget had just over 183,000 appropriation in each year of the biennium. This increases that appropriation to $253,033 in each year of the biennium.
Any questions about this? Senator Moore.
I guess everybody's being very quiet today. I would actually make the motion to go ahead and move both of the items on page 112 into the change package.
I would second that.
Technically, it's just the last item that we're revising, right? That's the revision of the two.
Correct, yes.
So, so that's been moved and seconded. All those in favor of moving the initiative on page 112 into the change package? Thank you.
So next we're on to page 113. These are two new initiatives in the change package in the Mental Health Services Community account Z198. Both of these initiatives are establishing positions. The first one establishes 2 Nurse 3 positions to review critical incidents involving recipients of behavioral health services. The second initiative establishes 3 Comprehensive Health Planner 2 positions, one to be the RFP coordinator, one to be the grant manager, and one to be the consent decree coordinator. These both have corresponding initiatives on page 127. And that is in the Office of Substance Abuse Mental Health Services account Z199. And on page 127, it's the second initiative is the 2 Nurse 3 positions. And the third initiative are the 3 Comprehensive Health Planner 2 positions. And you can see that these are all general fund increases in both accounts.
Yes, Representative Javner.
Thank you very much, Senator Claxton. I just have a quick question to the department. If there is a way that we will be having a report back, so to speak, from the department on positions as they go forward with them, with the filling of these positions, if we know when they're filled or you're having difficulties filling these nurse positions.
Certainly. Well, I'm just to make sure I caught all that. You just want to report out on the recruitment and retention of the positions after they're passed?
Exactly.
Of course.
Thank you.
Thank you.
Can I make a motion, Senator Claxton?
Please, please.
I make a motion to move these into the change package, please.
So that's the 2 items on 113 and the corresponding 2 items on 127.
Yes.
And I'll second the motion.
Made and seconded. Any additional questions, discussion? All those in favor of moving those items into the change package? Thank you very much. Good.
So now, after other votes today, we can already move on to page 118. And it looks like these are new initiatives from the change package, and there's only one of them left on this page to vote. This is in the nursing facilities account 0148. And this one initiative provides one-time funding to support nursing facilities for increased costs and lost revenue during the COVID-19 pandemic. Has a $6.7 million general fund appropriation one time in the first year of the biennium, and corresponding federal expenditure fund and other special revenue fund allocation increases.
Senator Moore.
Thank you. I strongly make the motion to move this line into the change package.
I'll second.
Anybody want to strongly second? So any discussion of this item? This looks good. All those in favor of moving this into the change package? Thank you.
So now we're on to page 119. These are new initiatives from the change package in the Office for Family Independence account Z020. The first initiative provides funding for third-party technology-related costs due to an increased operational cost of the ACES system. The second initiative establishes one limited period social services program specialist 2 position that goes through June 17, 2023. The final initiative on this page has already been voted above. So it's just these 2 initiatives we need to vote on now.
Any questions? Yes, Senator Moore.
I will make the motion to move those 2 items into the change package.
Second.
Moved and seconded. Not seeing any further discussion. Show of hands for those wanting to move it into the change package. That will be 11-0. 11 yay. Thank you.
I don't mean to be pedantic, but it's actually 10.
It's what?
It's actually 10.
Am I-
Representative
did we lose
Stover
somebody
has Representative Stover.
Oh. Usually she emails me when she goes. Thank you. All right.
So now we're on to page 120. This is a new initiative in the budget in the Office of Child and Family Services Central account account 0307. This establishes one identification specialist 2 position to support children's residential treatment facilities background checks. This is a general fund appropriation of $54,763 in year 1 and $56,964 in year 2, with a corresponding other special revenue fund allocation increase.
Representative Meyer.
Thank you, Mr. Chair. I would move the ID Specialist 2 position initiative into the budget.
I'll second the motion.
Moved and seconded. I'm not seeing additional hands for discussion. All those in favor of moving that into the change package? Thank you.
Now we're on to page 121. There are a few initiatives here. These are all new from the change package in the Office of Main Care Services account 0129. The first one provides funding to conduct the recommended rate and methodology study from the Office of Main Care Services Comprehensive Rate System Evaluation. This has a general fund appropriation of $837,500 in year 1 and $737,500 in year 2. The second initiative on this page provides funding for consultant contracts to implement the Certified Community Behavioral Health Clinic Service Delivery Model. This has a general fund appropriation of $50,000 in year 1 and $225,000 in year 2. Item 3 on this page was voted in yesterday. So the only other item is the last item on this page, which continues one limited period Comprehensive Health Planner 2 position through June 17th, 2023. This has a general fund impact of $25,400 in year 1, $26,578 in year 2, with a corresponding federal block grant fund allocation increase.
Thank you, Luke. Any questions about the items on page 121? Should we consider the whole page, or would we rather do it item by item? Senator Moore.
I would make the motion to go ahead and move all three of those into the change package on page 121.
I'll second that.
Moved and seconded. Additional discussions. All those in favor of moving the residual items, the three on one page 121 into the change package? Very good.
All right, so then we're on to page 122. This has three more new initiatives in the Office of Main Care Services account 0129. The first one establishes 3 Public Service Coordinator 1 positions, 1 Comprehensive Health Planner 2 position, and 1 limited period Comprehensive Health Planner 2 position in the Office of Main Care Services to implement recommendations from the OMS Comprehensive Rate System Evaluation. This has a general fund impact of $275,405 in year 1 and $288,337 in year 2, with a corresponding federal expenditure fund allocation increase. The second item on this page establishes 1 limited period Social Services Program Specialist 2 position, 1 limited period Management Analyst 2 position, and 1 limited period Public Service Coordinator 1 position, and 1 limited period Social Services Manager 2 position to implement the Certified Community Behavioral Health Clinic Service Delivery Model. This has a general fund impact of $203,198 in year 1 and $215,538 in year 2, with a corresponding federal expenditure fund allocation. And the final one on this page and in this account establishes 1 limited period Public Service Coordinator 2 position to serve as the Support for Me Program Manager through June 17th, 2023. This has a general fund impact of $59,320 in year 1 and $62,829 in year 2, with a corresponding federal expenditure fund allocation increase.
Yes, Senator Moore.
I would make the motion to move all three of these initiatives that are on page 122 into the change package.
Second.
And not seeing additional hands. So all those in favor of moving into the change package, please indicate, hand up. Very good. Thank you.
So based on some votes from earlier today, we now can move all the way to page 129. And page 129 is a new initiative from the change package in the PNMI Room and Board account Z009. This provides one-time funding to support Main Care Benefits Manual, Chapter 3, Section 97, Appendix C, for increased cost and lost revenue during the COVID-19 pandemic. This has a general fund increase of $706,200.
Representative Meyer.
Thank you, Mr. Chair. I would move this initiative into the change package.
I'll second that.
And seconded. Any other questions, hands? So all those in favor of moving that into the change package, please so indicate. Thank you all.
Now we can move on to page 135. And page 135 has a new initiative in the state-funded foster care adoption assistance account 0139. This the first initiative on this page has already been voted in, so we're only worried about the second initiative, which continues 1 limited period Public Service Manager 2 position to serve as a comprehensive child welfare information system business lead This position ends on June 18th, 2022. So this is only in the first year of the biennium. It has a general fund increase of $63,572 with a corresponding other special revenue fund allocation increase.
Representative Meyer?
Thank you, Mr. Chair. I would move this initiative into the change package.
And I'll second it.
What a team. All right, any other discussion? All those favor of moving the second item on page 135 into the change package? Very good.
So that gets us on to the language parts. I'm just making sure I have the ones that were tabled yesterday, which were part RR and part triple D, that'd be DDD. And I also had to point out, I'm sorry, in the midst of combining all this and looking for all the right items in the language, I missed two parts that should have also been part of your review. So I sent those to you separately today. So I can talk about those as well briefly, just to see if there's any questions you want to get out about those items. So the first one is part OOO, and this revises some language in statute. And I'll just read you the summary of what it does. It amends the existing authority of DHHS to establish fee schedules for main care services to require review on a regular schedule, to clarify that the rulemaking is not required for the adoption of fee schedules except where specifically provided in Title 22, Chapter 855, and to require that the rate schedules and cost of living increases be posted on the department's website.
So that's OOO.
Yes.
Okay. Any questions about that one? Okay. Representative Javner.
Thank you, Senator Claxton. Can you just have the department chime in for a little bit on the reasoning behind running this? In my opinion, it just feels a little bit like it's taking oversight away from the committee. And I'm wondering what their idea is behind not having the annual review. If they could just speak to that, that'd be greatly appreciated.
Thank you, Representative Javner. I'm happy to do that. As we spoke to in our presentation last week, we do have plans for a likely more comprehensive bill for the upcoming winter session that would take a longer term view of rate reform, including, for example, the creation of a technical advisory panel, because we do feel that it is appropriate to have a broad set of experts so that the committee and the legislature as a whole can have confidence in the amount of oversight or input into the rate setting process. With this particular language change, our intent was really, what are the bare bone changes that we can make in order to do the work that needs to get done to implement the changes that you have just voted on. I do note that it looks like we are reducing the review. I will say that even though this budget language states that there is annual adjustment, that has not been the case for over a decade. so I will admit that, so what we are proposing is an absolute improvement to the reality of this situation in terms of frequency of review, even though it looks like it's less review, it is not. And frankly, annual review of every single rate within main care would be quite a bite for the department to take. So this commits us to the regular review, and also in part because we have initiatives that touch so many different sections of policy. If we had to do rate setting, if we had to do rulemaking for all of those sections of policy for next July, we might not get through all the changes that we've proposed. So we are hoping that by committing to regular review, by transparently posting the changes, and then in our second phase of legislation, we'll put additional protections as well as requirements for stakeholder engagement in place when we have the time for broader conversations. And I did also just want to note that anything that currently requires legislative approval, anything that's major substantive, will stay that way. We are not asking to change that requirement in these rule in the edits here.
So there's really 3 or 4 changes in the body of what's here. The other already exists, right?
I'm sorry, I'm not sure what you mean by the other already exists.
Yeah, it wasn't very articulately asked. In the question, it's several pages long, what we got from Luke. It's 3 and goes on to the 4th. The real changes are towards the middle of the third page. Other than that, the language is that doesn't change. Is that right?
That's correct. So if you look at the top of page 3, the language does currently say annual, although again, it's been at least a decade since that's happened. So we specify that it needs to be a regular schedule, which is not what is happening currently. And that, again, in order to get through the work of this next year, having to do rules for non-major substantive rules will make it difficult for us to be able to make the investments in standardization that we plan to make. So that's pretty much a summary of what these changes make.
And the initial change is that there will be now a website posting, which has not been done in the past either. So that's additional argument for transparency, or even in support of transparency. Representative Javner.
Thank you, Senator Axton. Just to follow up, thank you, Director Probert. I appreciate that. I'm just curious, you mentioned for the departments to be able to have, to be able to make bare bones changes. Could you just briefly even just mention like what a couple of those changes might look like that you're looking at when you say bare bones changes?
Sure. So the bare bones changes I was referring to were just the language edits that are here on page 3. So when we're talking about our initiative to do the COLA adjustment that was just voted ought to pass, when we're talking about the initiative to standardize the percent in year of the Medicare, standardize and implement the percent in year of Medicare that we use for a number of services. Those changes go across many sections of policy. And if we have to get federal authority for that, if we also had to do rulemaking for every single policy impacted by those initiatives, it would be very difficult to implement those on the timeline. So we plan to do more engagement around a more comprehensive look that would include a technical advisory panel for our longer term plan for rate reform, but these changes are just really meant to get us through this biennium and the work that this committee has indicated that they support.
Anna, you had your hand up?
Yeah, I just had a couple of questions, and I guess they're kind of for Michelle and for Molly. I mean, I understand what you're looking for in terms of the COLAs and not having to go through rulemaking when you do COLAs. I completely get that. I'm just wondering if you might need some language to clarify that you're not actually making any changes to the major substantive rules, because there are some major substantive Chapter 3 rules like home health and PNMIs, I think, two that spring to mind. And you mentioned that you weren't planning on changing any of those authority, and I just think that language might need clarifying. And you may also need some notwithstanding language. It's just cleanup stuff that I'm suggesting here that goes along with what you're saying. But I just wanted to mention that, and I'm glad you answered that. You answered the question before I asked about major substantive rules, because that's exactly where I was going.
Happy to work on clarifying language.
Okay. Yes, Representative Javner.
Thank you, Senator Claxton. So with that in mind then, is it possible for us to see that clarified language first before voting, or do we have to on this too?
You know, my understanding is we're already a day later than we're supposed to be to report back to appropriations, which isn't a no, Representative Javner. It's a, I'll try and do my best with the department, but I can't promise it.
Sure, no problem. Thank you. I appreciate that, Anne.
All right. Do we want to wait to see language? Do we consider it language review? We'll wait to see it.
If you're
Okay.
planning on taking a break anyway, we can see what we can do.
Very good. All right. So let's leave that unattended to for right now and hear from Luke about actually WWW is the newest edition. Does somebody want to speak to that?
So part WWW, this is a change that prohibits the sale and distribution of flavored tobacco products, including flavored cigars and flavored electronic smoking devices, but not including marijuana for medical use, adult use marijuana, or hemp, beginning on January 1st, 2022. Unlike sometimes where we have language where there's also initiative that goes along with it, there is a revenue decrease that corresponds with this particular initiative, but revenue decreases don't have an actual line to vote in. So I just wanted you to know there is something that corresponds with this, but it's just not something you need to vote on.
Okay. Senator Moore.
Thank you, Senator Claxton. I guess I'm just trying to understand why we are putting this into language. We have that LD 1550 bill that we've been working on, and it's, we're not there yet. I mean, we had a divided report coming out of it. I am not comfortable with having this into the language portion of our change package without the proper action with LD 1550.
Anybody want to address why the need for language for that we don't have for other bills? Yes, Molly?
Sure, I can do that. I think, as you see with other language portions, the budget is an opportunity for the governor to outline her spending priorities, and this is among them, which is why it's in this change package.
Erin?
There are some differences between the language proposed in the change package than the language of the majority report of LD 1550. I think the two that I've noted so far are that flavored tobacco product expressly exempts medical use or adult use marijuana, but that also this prohibition includes not just retailers, which was the focus of 1550, but also distributors. And again, that was for the majority report of 1550. The minority report went a different direction completely.
Mm-hmm. Yes, Representative Javner.
Thank you, Senator Claxton. Briefly then, can you just remind me what the difference between the retailers and distributors?
Not off the top of my head, Representative. I would need a minute to look into it. Sorry, I didn't know we were going here today. Yeah.
Thank you.
And the other corollary question to that is, are those terms defined in statute somewhere? Or are those just common understanding? And I don't know.
No, they're defined somewhere. I just don't have an encyclopedic knowledge to speak off the cuff.
Oh. Okay. So we're not ready to get all the questions answered on WWW yet. And we still have two more items from prior. So does this feel like a good time to take a hour-long lunch break? Come back at 1:30 and deal with the 4 language items that haven't been dealt with to this point. Is everybody okay with that? All right. Very good. So we will reconvene the committee at 1:30 and caucus maybe, Representative Meyer?
Yeah.
At when?
Could we caucus at 1?
Sure. Okay. All right. Thank you. Very good. We'll be back then at 1:30. Thank you all for your work of getting through the change package. So as soon as we see, well, I suppose since we've already convened, we don't need 7 to get started again.
Well, I think both Kathy and I sorry, Kathy, I don't really speak.
Thank you, Ann. So, all right. All right, so we'll get back to the language that we, of the change package. We had some left over from yesterday, so if we're okay to start there, we can start with RR, which gives the commissioner the appointing privileges for the director of the state-based marketplace. Any questions, comments about RR? Which is tucked away on page 31 of the language handout. So I'm not hearing lots of comments. So Representative Javner.
Thank you, Senator Claxton. Just have a quick question concerning the appointment of this position by the commissioner. Can you just remind me, are there any other positions that are appointed by the commissioner in this in the same aspect as this position? And another part of that is this wouldn't be something that would come before the committee to be needing approval then if it's appointed by the commissioner.
That's correct. That's correct. My position, for example, is appointed by the commissioner, so is Molly's. There are several others in the commissioner's office that is appointed positions as opposed to confidential or bargaining unit. Again, this would just, I believe the Maid and Main bill established 6 positions in support of the state-based marketplace, and we're just changing the executive director from a confidential position to an appointed position. And it would not need, it would just follow other hiring procedures like any other appointed position. We would recruit for it and fill it, and would need legislative approval to fill. That's correct.
Thank you.
Of course.
Any other comments or questions? Is your hand? Yeah. All right. Then not hearing any other comments or questions, I'd entertain a motion on part RR of the language. Representative Meyer.
Thank you, Mr. Chair. I would move part RR into the change package.
Second.
There's a second. Motion been made and seconded. Is there any additional discussion? Any clarification? So why don't we have Ms. Swithy run the tally on this one? Oh, we're still on 2 screens. That just messes me up.
Representative Zager.
Yes.
Representative Zager, yes. Representative Melarano. Representative Melarano is absent. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci. Senator Baldacci is absent. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
No.
Representative Griffin, no. Representative Connor.
No.
Representative Connor, no. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner.
No.
Representative Javner, no. Senator Moore.
No.
Senator Moore, no. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 7 yes, 4 no, 2 absent.
And we also had leftover from yesterday, DDD, which is on page 39 of the original handout or the language handout. And that relates to expansion of CHIP. Any questions about this one? I'm not seeing any. Representative Meyer.
Thank you, Mr. Chair. I'd like to make a motion to move Part DDD into the budget.
Second.
Moved and seconded. Any additional questions or discussions? Then Carrie, would you collect the vote?
Representative Zager.
Yes.
Representative Zager, yes. Representative Melorano. Representative Melorano is absent. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci. Senator Baldacci is absent. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
No.
Representative Griffin, no. Representative Connor.
No.
Representative Connor, no. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner.
No.
Representative Javner, no. Senator Moore.
No.
Senator Moore, no. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 7 yes, 4 no, 2 absent.
And then newer today is part 000. And any comments, questions about that one?
Mr. Chair, Anna has her hand up.
Yeah, I'm busy looking up Luke's handout again so I can refer to it. Hello, Anna.
Hi. I haven't been able to draft this yet, but we have some sort of questions about what you might want to do. And I don't see Michelle, but I know that Molly is here. So there are a couple of options for you. The first one is, and I'm going to talk about the COLA specifically because, first of all, because that's the more straightforward piece, I think. So as you know, there are some initiatives in the budget that apply COLAs to a number of main care sections, and under the current sort of structure of how the COLAs are adopted, the department goes through rulemaking. If you are interested in allowing the department to adopt COLAs for Medicaid specifically, without going through rulemaking, which, you know, this is, I can certainly understand, I mean, this is your decision to make, but I can certainly understand why the department don't want to go through rulemaking every time they're adopting a COLA, because it's kind of a pain in the neck and nobody's opposed to it. Everybody wants a COLA. So if you wanted to do that, then you wouldn't need to notwithstand rulemaking. You would just say in the statute that the department can go ahead and adopt COLAs, and because the statute will always trump the rules, if you say the department can adopt COLAs, then they can adopt COLAs. There are some sort of more specific questions that you would need to answer in order to know exactly how to draft that if you're interested in moving forward with that. There are some, first of all, whether you want to specifically, and I think this is my understanding from the department, that this would specifically apply to Medicaid. I don't know what that means for some of the state-funded programs, but I'm going to let them speak up for that because I don't know the answer and I didn't think to ask that question earlier. But my understanding is that this is about Medicaid. There are some other sections in the statute and an unallocated language in budgets or past bills that apply COLAs to. For example, there is a COLA in the statute for nursing facilities. There is also some unallocated language requiring COLAs for adult family care homes and PNMI Appendix Cs, for example. There may be some others. And those are Medicaid. So questions for you and for the department, if you want to move forward with this, is whether you want to, I wrote it down somewhere and now I can't find my piece of paper that says it, whether you want to accept as provided in law. In other words, if you want to leave the nursing facilities and the unallocated language alone and only make it apply to everything else in Medicaid, then you would say except as otherwise provided in law. If you wanted to suck all of that in, the PNMIs and the adult family care homes and the nursing facilities, then you would say notwithstanding any other section of law. So that's not a decision for me to make. So the first question is whether you want to have the COLA in statute and allow them to do that. And then the next question is whether you suck in everybody in Medicaid or whether you only want the ones that are not currently have something else in law somewhere else. And then the third question, which is a technical question that I don't have the answer to, is what kind of cost of living increase they would be using, because you would probably want to say what that is, whether it's by reference or something. And I don't know the answer to that. So that's the first part. The second part, it might be, I don't know whether you want me to sort of pause there or whether you want me to carry on with the other issue, which is specific to the initiatives in this budget. Do you want me to stop there, Senator?
Let's find out how what we might have for further explanations from the department. Before we do that, we'll go to Representative Javner and then Molly.
Thank you, Representative. And I could just have clarification on when you're talking about the statutes. Are you referencing this language piece that would put in statutes, or are you talk different? I'm
referencing the section. In other words, section 3173 of Title 22, which is the section that they're amending. I'm saying that it would be different language from what's written in Part 000. So, but when I say the statute, I mean if you put a COLA language, allowing the department to adopt COLAs in Medicaid into Title 22, 3173, then they can do that without going through rulemaking. So it would be different language. I tried to write it for you, but it took me too long to get my head around what they were looking for. But it would, when I say statute, I mean that because if you put it in the red books, then it trumps rules.
Yep.
So yeah, different language, but there's a correct section of law.
Thank you.
That language already exists and we're modifying language in the red book. Okay, red books. Okay. Any other questions related to 000? How are folks feeling about putting in COLA changes into statute, giving the department the authorization? I was going to go to Molly next. Where'd Molly go? There you are, Molly.
Thanks. And I just, Director Probert unfortunately had another obligation, but Jenny Patterson, the policy director for Maine Care, is in the attendee list if you'd like to hear from her.
Sure, let me work on that. She's already been promoted, I think. Because there's nobody there but Zoom. She's been promoted.
I think Carrie was on it.
Carrie's much faster with that stuff than I. Welcome, Jennifer Patterson. How are you?
I am well, thank you, Mr. Chairman. Good morning, good afternoon, I guess it is.
Good afternoon. We're trying to...
Again, I'm Jennifer Patterson. I'm the Maine Care Policy Director.
So we're trying to sort out whether it makes sense to have the department make COLA changes without rulemaking and embed it in the statute or not. And does that meet your needs? Would that be helpful to the department? And how are we going to know what COLA and does that go on the website?
Yes, thank you, Mr. Chairman. And I believe that I did participate in the conversation with Ms. Broom earlier today, and what she said does capture what we are trying to accomplish. I think, as you may have heard earlier from others, the purpose of this particular provision is to be the first step in the rate system. So the goal would be to put the department in a position where we can move forward with all of the initiatives that have been considered. And for the COLAs in particular, given the complexity of the rulemaking process for something that straightforward, it would take a lot of time in the policy unit to address each section of policy. So that was the intention, was to be able to do just that particular piece without having to engage in the section by section rulemaking effort. And we do understand that there may need to be an adjustment in the language, but as Ms. Broom had mentioned, the intent would be to actually put that into the statute, section 3173, which already addresses this type of action by the department.
And I don't know, does this is specific to main care Medicaid? These changes?
It's specific to main care. I don't know whether Molly or Ben could speak to the degree to which other programs might follow the main care schedule of payments. I don't have that specific information.
And we've also heard that there was a question about which COLA is to be used, and we've heard from Director Probert that it depends. So that's my follow-up question too. Would the COLA changes be posted on the website the way we've heard about it from this morning?
That was the intent.
Sorry.
Yes, so the intent would be to have all of that be posted on the department's website at the time it's put into effect. Probably I have less detail than Director Probert did in terms of the actual methodology, but certainly the intent would be to be extremely transparent about that.
Okay. That's part of the language that's there now. Representative Javner.
Thank you, Senator Claxton. I can appreciate that intent piece, but as we've seen in the language of, that was the original language that's being amended, the intent was for, an annual review of rates, which we all know has not happened. So what assurance is the department able to give us that this transparency is going to happen if we move forward with this piece of language?
Yes, so thank you for that question. And I believe that Director Probert probably testified that this is intended as the first step, so that the intent would be to have the ability to do this first round of initiatives, which the committee has reviewed with specificity. And then in a subsequent session, there would be a bill that would lay out that entire process in a way that we would move forward with it on a regular basis. And again, I think in looking at the current language of the statute, there are other provisions that do address, not this section that's being amended, but that do address the methodology. So the intent was to have there be some rationality that would go beyond an annual review, but that would encompass all of that. But that would be a later step.
Does that answer your question, Representative Javner? So we could, as a committee, ask for an annual update on how the COLA process is coming and how the rate making is coming. Get that every January until such time as there are new rules put in place and new statutes to make that happen more automatically with some oversight.
Yes, absolutely.
Wouldn't you agree? Yes, thank you. That's okay. All right. So is that where you were going, Representative Javner, in terms of accountability, predictability?
On one level, yes, but another level is, moving forward, if, move forward with this piece of language, how that is all going to actually, in reality, what's that going to look like? So again, I think an annual review from the committee is important. I think that's definitely a step that to put in there. I just also think that, again, this overview of the process, rate making, rule changes that, it's going to be very important that we keep close track of what is happening. I understand. I totally can see the department's positioning on trying to make it easier. I understand that completely. Still, I'm very reticent on giving a blanket level of authorization. What I view as many moving parts and pieces. So, thank you.
Yes, Mr. Mann.
Thanks. I just wanted to clarify that that the ability to suspend rulemaking for non-major substantive for the COLAs is allowing us to more simplify. It's allowing us to implement the rate increases we're asking for in the budget here. The language that we're proposing to update that hasn't been followed in over a decade is for an annual review. So, there's 9.7 million general fund dollars being asked for the Medicare standardization and 8.4 million general fund for the COLAs. We implement, there's rate changes every year seemingly, and that's implemented in the budget. We implement those. And this would streamline that implementation which is separate and distinct from the annual review of rates, which is also part of Section 3173, but different from the issue of actually implementing the rates, which we're asking for the authority to do that on a more streamlined basis, considering it's, I might get this wrong, but I think it's 16 different sections of policy for the COLAs and 13 different sections of policy for the Medicare standardization, which would involve an enormous amount of work for the policy team if we were required to do rulemaking for each of those sections individually.
Yes, Anna.
Perhaps it's worth actually revisiting all of the pieces that are in Part 000, because I think that's part of what's getting all mixed up here. So we're talking about 2 or 3 different things depending on how you count. One is this COLA issue, which is specific to COLAs. The second is the issue that the Deputy Commissioner was just talking about, which is related to the annual review, which doesn't really happen and makes that section of law, kind of useless if it's not actually, followed. So, and I completely understand that. So that's another piece of it, of not requiring that annual review that doesn't actually happen. And then the third thing is the issue, which you can't tell really by looking at the statutory language that's been suggested in Part 000, but are related to the initiatives in the budget that are specific to the rulemaking evaluation sort of process. There's a whole lot of initiatives in here that are related to rulemaking that are not related to COLAs. So, I think there's sort of 3 separate things that it's worth thinking about individually in terms of where you want to go with them. And one is COLAs, one is the annual issue, and then the third is whether you want to require, as they do now, rulemaking for implementing all of these initiatives that are in the budget that are specifically related to rulemaking. And that was the issue that I hadn't got to yet. And I think there is certainly something odd about changing the statute for something that is short term. In other words, if you were if you wanted to allow the department to implement these initiatives related to the rate review, separating COLAs out even, or including the COLAs if you like, if you wanted to allow the department to go forward and do that specifically related to the initiatives that are in the budget, then you could do that in unallocated language instead of changing the statute. So it's one of the many options that you have. If you want to, part of the reason that we had this conversation about COLAs is because every time there's a COLA, the department has to go through rules. They have to do this every time in Section 67 for nursing facilities, for example. Every time they have to go through rulemaking to do that. And maybe it makes sense not to have to do that, given that they have to go through rulemaking all the time for all sorts of things. That's a decision for you to make. But if you don't want to put COLAs in the statute and you want to wait until the department comes back with its sort of big proposal with the technical board and all of that, then another option is, instead of amending this, is to have some unallocated language that allows the department to go and implement the provisions of this act. And you can specify what those provisions are. I mean, I think you'd have to specify it in language, but specify what those provisions are in terms of the evaluations, including the COLAs and the Medicare thing, that are all related to the rate evaluation, and allow them to do that without going through rulemaking, but you could do it in unallocated language. So that's another option that is separate from the annual issue, although I suppose you can do all of that at once too. You just know that this doesn't get followed. But you would also want to include the website thing in that language so that you can see where it is when it's done. And please, Deputy Commissioner or Molly, tell me if I've gone somewhere wrong there. But that's another option if you're not comfortable with putting the COLA in law and putting the other pieces in unallocated language. You can put the whole thing in unallocated language and just have it apply to what's in the budget. Did that make any sense?
Yes, Mr. Mann.
Sorry, to help streamline and simplify this, we were not intending to change any services that currently get COLAs, so nursing facilities, PNMICs, were not intended to be affected by this legislative this language change. So we can just take that off the table if it's the prerogative of the committee, because we were not intending to do that. We are just looking to streamline the language for the upcoming COLAs that would be implemented based on everything we worked through this morning.
Specific to the change package?
The change package includes the Medicare standardization and the COLA implementation. Yes.
Right. Okay, so to make it narrower, more specific, and would the department be okay if that was unallocated language? If we did all of it that way in one? Would that still accomplish what the department wants?
I think if the expectation is that it applies to this one-time work, that could be okay, but I defer to Jenny about whether it'd be helpful to have it in statute as these COLAs get updated in future years.
It's certainly true that with respect to the rate schedules, it could be an unallocated language, and that would be consistent. And I think it would be more specific to the initiatives that were described, and it would be more short term, as Ms. Broom has pointed out. On the COLAs, I think that is also true. I'm just a little less certain. Because I didn't spend as much time looking through which sections of policy already include that or don't include that.
So the department could also come back when they've done more work in this arena to with a package that would say this should go in the statute, this should stay unallocated, and then the committee would be in a position to respond to that. Okay. Molly?
I wonder if the, and this is a question for the analysts, but I wonder if the annual COLA piece could be in statute so that as we update those in perpetuity, that would be in statute, but the rest could be unallocated.
It's fine with me, Molly. That's a policy decision, not an analyst decision.
As long as it's possible, that's helpful.
Yeah, the answer to your question is yes, it's possible. So are there any COLAs out there that we would be unintentionally including in this in other sections of statute?
Well, that's fairly easy to fix, though. I mean, that was the language of except as otherwise provided in law. That's how you avoid the nursing homes, the assisted living, etc., whoever it is that gets those COLAs that Ben was talking about. So that's straightforward language.
All right. So specific to the COLAs, it's certainly been, correct me if I'm wrong, so speak up committee, the sense from me that the COLAs make sense in this work so that we don't fall as far behind as we did. So anything we do to protect COLAs and make them happen more automatically with some oversight is a win. So I think I've stated that to the satisfaction of the people with the nodding head. So thank you. That being the case, then the next question is how best to accomplish that. And that sounds like putting it in statute, that part, that particular aspect of COLAs could happen without rulemaking. And then we may need to use the phrase a COLA instead of the COLA, because it's going to be different depending on whether we use the medical CPI or the CPI or whatever we use. And I heard from Director Probert that might be different depending upon the line item.
That's accurate. The language currently refers to it as cost of living increases. So I think it does make it plural already.
Okay, so all right.
And then it says as appropriate.
As appropriate. Okay. So from the committee, how are folks feeling okay with putting that particular change in statute, understanding there's some more language revision to be done? Thumbs up, thumbs down? Okay. So generally positive. Yes, Representative Jabner.
Thank you, Senator Claxton. I was but I will go on record that I do.
Your audio is all broken up, Representative Jabner.
No.
You need a bigger dish.
Yes, it's very windy here today.
Yeah. So what were you going to say?
I was going to say, I agree with bringing the COLA piece out and handling that separately.
Okay.
Can you hear that?
Bringing it out, or do you mean like putting it in statute?
Excuse me. Yes, exactly.
All right. So what we're looking for is language that we can put into statute that accomplishes what we just said we'd like to do. Is that enough direction, Anna, for you to work on? Specific to COLAs now.
Yeah, it would largely say something like this. Except as otherwise provided in law, the department may apply cost of living increases as appropriate to main care reimbursement rates. That's basically what it would say.
As long as they're posted on the website.
Yes. Sorry.
And part of the annual review process for rate setting.
Actually,
ignore that if it confounds things.
I don't think it does relate to the annual review part. I think you're just basically allowing the department to apply cost of living increases and put them on the website You wouldn't even refer to rulemaking because you would be saying in statute that you could do that.
It's okay to do this.
Yeah, and
So-
I'm just going to make sure that people don't shake their head at me from the department.
So I'll check in with Ms. Patterson and Mr. Mann. Is that acceptable to the department and give you the flexibility you need to do the work?
I believe that it would. I think having it in statute would be helpful, but it does not have to be in the manner that it was drafted in this OOO.
Okay. Well, we have some magic makers on our committee, and Anna will make it read right.
I know you've heard from Director Probert already on this, but just as a reminder, we are intending to propose additional process changes to the review of rates going forward, and would like to work with this committee and providers and stakeholders to make sure that there is a sound process for regular reviews of rates, to make sure that reimbursement is sufficient to providers, so that we can make sure that all of that is squared away. And it would likely involve an amendment to the language that we're looking at today, either today or in the future at some point.
That's what I understood from what was said earlier, that this is the start of some of that work to make more standard operating procedure. Okay. So I don't think then do we need to deal at all with the annual review? Do we want to take it out of statute? Do we want to reference it at all in this work? Understanding that it's going to be revised at some point. Representative Perry?
What about the possibility of putting in a plan of review will be brought forward? That way, annual says you got to look at everything annually. That gives them an opportunity to develop a plan and bring it forward.
How does that sound? That gives the department greater flexibility. It anticipates what you said you were going to be doing anyway, which is coming up with a master plan for doing this work. How does that sound to the committee?
I'm sorry, can you repeat that, Representative Perry? What you were looking for, instead of saying subject to annual review, what are you suggesting? As opposed to right now they have subject to department review on a regular schedule set by the department.
Right, and that the plan of review will be brought forward to.
And that plan would need to be reviewed by the committee for being adequate. That would be the normal course of events if that was considered major substantive, right?
I'm a little lost, I'm sorry.
Okay.
I don't understand what the suggestion for language is. I kind of understand the concept, but I don't understand what the suggestion for the language is around the annual review part.
I'm trying to not say annual review, but that there will be a plan of, regular review that the committee, that the department will develop and bring forward to the committee.
I think if you take out the part about the fee schedule not being required to be adopted as rules, that's kind of their proposal, which is that the fee schedule shall be subject to department review on a regular schedule set by the department. Am I missing something?
No, that sounds good. But we would strike any reference to an annual review until we heard what which is struck already.
If you propose that, yes, if you move forward with it. Okay, so that would leave you with what to do with the things in this budget, which is really what Ben cares about.
Which is the other part about implementing without rulemaking. Those items that have been that are accepted as part of the change package. Does that, so we could allow what gets voted on and what gets passed in the change package. to go forward without rulemaking.
You could allow that. So here's how I kind of think of it in my head. So often in budgets, you have that language that is an unallocated in most budgets that allows the department to have emergency rulemaking for things that are in the budget, right? Like that's fairly standard language that is often in the budget. What they're looking for is something similar to that without the rulemaking part. So if you wanted to move forward with that and you were comfortable with it, you could, notwithstanding the APA, but this is a one-time thing, that you could notwithstand the APA and allow the department to move forward with implementing those provisions in this act, and that would be whatever the supplemental or biennial, I can't quite remember which it is, but the next budget bill, that the department has that sort of jurisdiction over that is specifically related. I haven't got all of this written, but I know what I'm trying to say, that is specifically related to the rate review process. And I'm not sure those are the exact right words, but the department and I can figure out exactly how you'd refer to that, so that it doesn't refer to everything that's in the budget in the same way that that emergency rulemaking language usually applies to everything that DHHS have, but would specifically relate to the things to do with the rate review. I mean, that does suck in the COLAs, but you're also kind of taking care of that on an ongoing basis, but would allow the department to implement those things without going through rulemaking. If that's what you want to do, I believe that we can accomplish that. It would be language that only applies to that budget or this bill. Right. And then you will get whatever it is the department comes forward with in the future.
With some sort of monitoring process and what's the timeline for this, Ms. Patterson or Deputy Commissioner Mann?
The timeline for needing this
or developing the plan on terms of how to do what you're setting out to do with rate reviews? Or is that going to be a constantly revised plan over a while?
The COLAs, this is separate and distinct from the COLA issue. The larger process we will pull together. I think we still need to go through within the administration to determine what that looks like exactly and what we're proposing. But I think it could be ready for if there was the supplemental process in a year from now, the next time the legislature convenes.
That's what I'm asking. So would we have something to get an update about in January, or will we likely to have?
Without question, we can give you an update in January.
Okay, so that gives it a stop date. I just hate to say, we're going to launch this thing and trust it's going to happen. I'd like to put some sort of checkpoint in there, a milestone. So as of January, we could get a report on the progress of the department's efforts to develop a plan to regularly update rates. I see a head nod. Okay. So Anna, you can include some sort of language for a report date or mid-January report out.
If you need that, I'm not even sure that you do, and tell me, Ben, if I'm wrong. But there is nothing. Everything that you are looking forward to do without rulemaking is somehow involved in this budget, correct? Like the initiatives that are in this budget related to the rate review are the things that you need to be able to do without rulemaking. There's not anything else, correct?
I think the chairman was referring to, we're going to be putting a longer term strategy in place on how to review rates regularly. I think everything that's proposed in this biennial budget and the change package, we wanted to streamline the rulemaking process so we could ensure that we could get to all of those Medicare standardization and the COLAs, and we've separately done that. So there's two distinct things. We've tackled the COLAs. I think we're in agreement on that, and then we can report back and intend to report back to the legislature in January on the larger process going forward that would likely require statutory changes because we would want that permanent and ongoing.
Are you okay with that, Anna? Because that's what
Yeah,
I
so you want report back language in January.
Yeah.
That's fine.
Yes.
Okay, then I'll
We
add
want-
that in.
we
I'm
want
not sure
Perry-
it's the same section. It might be a separate piece of unallocated language, but absolutely I can do.
We want the Perry Amendment attached to it so that we can write legislation should it be a reasonable next step. Thank you
all
for helping.
developed the Perry Amendment while I wasn't in committee, and Erin had to explain to me what that was. I
Oh,
never
okay.
knew what you were all talking about.
Oh, okay. Thank you, Deputy Commissioner Mann, for that. I think we're on the same page. So how is the committee feeling about this aspect of a mid-January report back on the efforts to develop a plan for future rate increases, tested by whatever has been used currently between now and then, matured through that process? So is everybody okay with that language? Okay, so if part 000 now includes the COLA arrangement, we talked about leaving it in statute or putting it in statute and reflecting what's drafted here with some changes to come. And we have an annual report in unallocated language that lets us follow up on the process. Are folks feeling okay about that as OOO?
And the piece that allows them to not have rulemaking for all of the other pieces that are related. That's
right.
So that's separate from the COLAs and separate from
Right.
the report back. It's
Yeah.
its own thing.
Yeah. And I think it's because of the report back that we can feel okay about the other part. Okay. So are there questions or concerns about OOO at this point, understanding that it's in pencil on an envelope on Anna's desk? All right. And we'll get a chance to look. It'll be interesting to see what comes out of this. But so at this point, not seeing any other questions, not seeing Anna shaking her head or with that quizzical look we all have come to know and love, I'll entertain a motion about OOO. Representative Craven.
Thank you, Mr. Chair. I move OOO into the budget as amended many times.
Well said. With language to be refined, right? Is there a second for that motion? Who seconded it?
Rabner. if you hear me.
Okay, so it's been moved and seconded. Thank you for that. Is there additional discussion? Not seeing any. I think we can do this with a show of hands. All those in the committee who are in favor of moving this forward the way it's been amended. That's unanimous of those present. Thank you, people. That was way far into the weeds for me. Thanks for hanging in there. I'm glad there's some weeds people out there because that is not me.
And thank you, Mr. Chair, for navigating the committee through that.
All right, so that gets us through OOO. All right. And then the last one on the supplement that was sent around was WWW. And that's the, let's see, prohibits the sale and distribution of flavored tobacco products. Yes, Representative Craven.
Thank you, Mr. Chair. I would move WWW into the budget.
And is there a second for that?
Second.
Is there any discussion or conversation? I'm not seeing any, so I'll ask Ms. Withy to collect the votes.
Representative Zager.
Yes.
Representative Zager, yes. Representative Melorano. Representative Melorano is absent. Representative Stover. Representative Stover is absent. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
No.
Representative Griffin, no. Representative Connor.
No.
Representative Connor, no. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner.
No.
Representative Javner, no. Senator Moore.
No.
Senator Moore, no. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 7 yes, 4 no, 2 absent.
Thank you, Carrie. So related to the budget, but not on anything we have, is concerns about how we prioritize what we pass along to AFA. So I don't think that's necessarily the time to do that now, but I guess what I would do would be invite people to sort through the initiatives that on bills we've passed to try and come up with our priorities list. And maybe the chairs and leads could collect those and begin to understand. So for instance, the $5 million for tobacco education isn't in the budget, and it isn't in the change package, or it isn't in the continuation, it isn't in the change package, and it was passed unanimously. I think of that as a higher priority than some of the items that we dealt with. So if anybody's got favorites or ones that need to be emphasized, then I would ask that you get those to the chairs or leads. And then we can talk about next step after that, if that sounds okay to Senator Moore and Representative Griffin. I just want to get this process started while it's still relatively fresh and before that whole process is done with. Any comments from Representative Griffin or Senator Moore?
Well, no, other than I wish we were all in the same room and we could discuss this.
Yeah, no,
It was so much easier when we were setting priorities and we go, oh, yeah, that is a true priority, and makes it a little harder.
I just wanted to get something tangible in the absence of that. So if we had a few, somebody could say, well, you forgot about, or what do you think about, or thanks for reminding me. All right. You okay with that, Representative Griffin? Okay.
Yes.
Yes. Representative Madigan.
I just have a question. In the past years, when we've come to identifying our priorities, we've gotten a list of bills we passed. That just makes it easier to do that. I don't know how everyone else feels that's been on the committee before, but ranking them and taking a look at them and really thinking about, all right, I can choose 5 or whatever, kind of, I think helps solidify those priorities for each one of us. So.
Is that something that's easily produced for and sent to the committee? I've seen the report already, at least as of a certain date. That was the evidence I used with Anna to prove that we didn't pass everything, because there were 55 items on there where there were some ought not to passes.
That's what I was going to suggest, is that list that was sent in asking, for the our extension to be able to still meet as a committee through Wednesday. And that was the last list that I saw. And I thought that would be maybe something we could work from.
Yeah, sure. But I think people should have come having reviewed that list. And maybe we can do this tomorrow after we consider the bills that are still outstanding, and try and see how much we can do as a group, as an alternative to the committee room. Yes, Representative Perry?
I was just going to mention, not all bills have a fiscal note that goes to ANA and to the AFA. So, and I know in the past that we have been given a list of bills that go to AFA and for us to prioritize those. And it was helpful to have that designation. Otherwise, we'll be looking at a lot more bills.
No, that's a good point.
That's a good point. Yeah.
And I want to be mindful of our precious resources here. So I want to ask Aaron and Anna what it would take to produce that kind of list of potential bills to go to AFA.
I'm going to defer to Anna here, except that I think we don't create. I know you're talking about that committee summary report, which we can run, but like Representative Perry said, that's not what's in AFA. And so I think we need to ask our deputy director to pull that report. Is that right, Anna?
I think Luke looks like he's leaping to the rescue here.
Okay.
Yeah, that report is created in our office. And I honestly have no idea where it's at this point, because it's probably at the very bottom of a desk that is piled with fiscal notes to review. So I can certainly check in to see if there is some version of it out there, but it's kind of it's a little difficult because it's not something that just happens automatically. Every bill literally has to be tagged as going to the table, and I just don't know where that is at this point. But that's normally something that comes from our office.
Well, and we have a significant amount of bills that haven't been reported out that wouldn't have been flagged yet for the table. Is that right?
That will have fiscal notes.
Yeah, I mean, I have 16 amendments left to draft, and that's not counting the other ones I haven't shown you yet.
Yep.
And that's just me. That's not Erin. That's just me. Of course, she's more up to date because she always is. But
I have a whole bunch in my crate. I don't even know.
Yeah.
So the list is going to be incomplete. I think we have to accept that. And if we can get any sort of list, Luke, that will be helpful. And hopefully nobody will lose too much sleep over that, but it would be a tool. We can also circulate that other list that Senator Moore referred to. Make sure everybody has that most recent copy, so you don't pay attention to the ones that were ought not to pass. So I think that'll help a little bit. And this would be a whole lot easier if we had another 2 weeks. So I recognize that that's not the case. And AFA wanted our feedback today, and we got sort of dispensation to be a day later. So if we can identify our top 10, 15, 20, I think that would be helpful to the folks in AFA. You know, the votes, some of the votes are going to look the same, and they're not going to have a sense of what the priorities are. So, yes, Representative Perry?
Are you going to send us that list? Because I can't seem to find it.
Yeah, we can make sure. Where'd that come from, Senator Moore? I forgot.
I can't remember who sent it. I can't find the list right now. It was what was sent. It was what was sent to the presiding officer.
You're talking about the committee summary report that we run that doesn't distinguish between what's on the table and what's not, and it's attached to it was attached to the extension request, as you said.
Yes. Which was sent by Arlene Harrison, who's one of the secretaries in our office.
That's right, on Friday afternoon.
That's what I was looking for. Yeah.
Because I really don't see, given that the fiscal office and OPLA, for entirely different reasons, are all completely out straight. I don't see how we can create a list of what's going to the table for you at this point in time. And I have to tell you that personally, I need Mark and Luke to be tuning out fiscal notes more than just about anything. And I'm afraid that Mark's probably already pulling all-nighters, but I just don't see how you're going to be able to get a list of things headed to the table in the next couple of days.
We'll go with a list that was sent out Friday by Arlene. And people who have a favorite can look up and see if there's a fiscal note or not.
And you're welcome to shoot us a question if you want to know if we think there's going to be a fiscal note. We that's quicker for us to answer than it is to run a report.
Okay. So
send that list to us, because I really can't find it.
Yeah, we can send
one of us will find it and forward it to the committee.
One of us being Michelle or Ned. Yeah, Representative Griffin?
If it's the right list, I just went on my latest mail and put her name in and it's right, it just pops right up. For Arlene.
Arlene.
Is that the right-
Arlene
is that
Harrison.
the right one?
And it was Friday exactly at 2:47 p.m.
Right.
And who was that mailed to? Was that all the committee or just chairs and leads?
All the committee.
Everybody.
And it said it's labeled HHS deadline extension request.
Right.
So it's part of the letter, asking for the extension for us to be able to meet this week, but it has the bills that we have processed.
Right. And just kind of scroll down on that.
Yeah.
Right.
It's 12 pages. So.
Friday, that's okay. I will personally forward it to the committee in case it doesn't surface in your inbox. I'll do that. That's easy enough. Okay, are there any other issues to address?
We do actually have amendment review before you try to wrap up.
No, I was gonna say we could do amendments if the committee's willing. I was gonna say that honestly, Representative Zager, don't be laughing at me.
I don't think he believes you.
I know he doesn't believe me, but I actually was gonna say it this time. Go ahead. So.
And if there is anything that you need us to put in the memo to appropriations related to the budget change package, please let us know. Because we'll be putting that together ASAP. Are you ready, Erin, or do you want me to start?
I can be ready.
Okay.
This is LD 559. You had an amendment that required, well, you added the ability of the committee to report out legislation relating to the report from the department. This is the bill about adding persons with acquired brain injuries to the statutes about their rights, responsibilities, grievance procedures, etc. You added a rulemaking provision, which is here, which would go into effect. The rules would be adopted by July 1, 2022, which would be 6 months after the conclusion of a stakeholder group that's in the original bill will have completed its work to make recommendations about what those rules should be. And you can see that they're required to consider that the recommendations of that stakeholder group. And I think that's it on this one. Oh, there's a fiscal note that shows, so you had directed there on the preliminary fiscal impact statement, there was a cost to the department for about $16,000 in legal fees to the Office of the Attorney General, which you had directed the appropriation in the legislation to be removed. And it has also, based on additional information received from the department, not been included in the note section here as well. So it only shows a minor cost increase to the general fund.
Good.
Can you see 837?
Yes.
Or did it disappear? Okay. This bill combined 3 department bills on child protection that added truancy and child sex trafficking to the definition of abuse and neglect. And it also talked about the disclosure of records, that if the department was producing records, it would only be producing its own records, not records of providers. So you can see here that truancy is added to the definition here, clarifying that it's a person responsible for the child causing the truancy. Also that it's child sex trafficking by any person, whether or not the person is responsible for the child. The definition of sex trafficking is defined here. And also there's a cross-reference here to what a commercial sex act means under federal law. And then this is the same disclosure provision that you saw in the underlying bill.
Okay.
And no fiscal impact as a result of this legislation. LD 415 is the combination of 2 bills dealing with targeted case management services. One of them was LD 360 and the other one was 415.
One of them was a rate bill and the other was an expansion of the eligibility requirements for targeted case management. And so this first provision here adds, adds pieces of the emergency legislation to, I forget why we added that. I'm sorry, I'm losing my my thought on this one.
That was a request to the committee.
Yeah, you had added some of the these reasons to make it an emergency.
Yeah.
You amended the resolve to provide that this date, this April 1 date was in the emergency clause, which doesn't make sense because now that you're combining them, those other provisions aren't affected by this target date. So instead it provides about expanded eligibility for the substance use disorder services or targeted case management services.
Yeah.
It changes the head notes of the two resolve sections to clarify which pieces are the rate pieces and which pieces are the eligibility pieces. It clarifies that the department's rulemaking wouldn't be in effect by April 1st, but that the rates as a result of the department's rulemaking would be effective April 1, which I think is the intent. It's not the timing of the rules, but the effective date of the rates. And then this section 2 is lifted from LD 360. And then you have appropriations section here. My understanding is that the appropriation section is a little bit higher than you originally saw under LD 415 because under 360 you're also expanding. In this bill is now simultaneously expanding eligibility for those services. So you're encompassing a greater number of people at the same time you're directing a rate increase. So this will look a little higher than it did on the preliminary fiscal that you saw in 415. And then that same information on the general fund and federal expenditures is included in the fiscal note.
Okay.
LD 1653 was the emergency medical services rule. You voted it ought to pass, but we have to go through a fiscal review anyway, but as expected, there's no fiscal note required. So this one is good to leave the committee as a straight ought to pass without a fiscal. But I wanted you to know that it came back.
Thank you.
And then finally on LD 197, this was the bill that would provide authorization for the department to spend 15 million of federal COVID-19 stimulus funding for community mental health service providers. And it shows here that there would be an allocation of 15 million in fiscal year 21-22.
Very good.
And those are my bills.
Thank you for sending those out last night or yesterday.
Okay, so I have 3, and I'm going to start with showing you one of the bills first. Can you see that? This is a LD 684.
No.
Oh, blasted. Okay, hang on. I must have missed a step here. All right, now you can, right?
No.
Sorry about that. You
Yep.
can't?
Now we
Okay.
can.
All right, so this is LD 684. This is a resolve related to nursing facilities, and this is about the high main care residence nursing facilities that are less it's getting rid of the language that's related to the less than median aggregate direct or routine allowable costs. This affects only about 6 facilities, I believe, and we now have the fiscal note, and eventually I'm going to find the right button and open it. So that is the fiscal note for this bill. And you can see, I mean, we expected it to have a cost, not a great cost, because it doesn't affect very many nursing facilities.
Right.
But that's that one. So that one is ready to go because it is a fiscal note only amendment. So then the next thing I wanted to show you was, I'm going to go back to the bill again. Where is the button? There. I'm sorry, I can't. Oops. Can you see the long-term care ombudsman program bill in front of you? So this is Representative Craven's bill. This is the stakeholder group that that Brenda Gallant puts together related to the assessment tool for family caregivers. These are the unpaid caregivers, and you had a small change to that. That looks like this. So the main change is related to this is including the stakeholder group. So this is representatives. You are adding hospitals, a statewide organization representing home care service providers. That's really Home Care and Hospice Alliance. And a home care service provider. I had thought during the work session that there were 4 because there were 2 recommendations that you had, or the 2 pieces of testimony that had added 2 members, but each of them had one that was the same. So it was actually only 3 hospitals, a statewide organization representing home care service providers, and a home care service provider. I don't have the fiscal note for this yet, but I'm expecting it not to need one. So I'm showing you this so that if I get the fiscal note I expect, then it can go out the door without bringing it back to you. If there is a fiscal note, I will obviously bring it back to you. And this is still a markup, but I know the final's on my desk because I tried to go in to move just a few, and while I was there, they dumped a whole bunch more on me. So that's that one. And then I have one more really nice big one to show you. So this is wait lists. So this bill is, it's really an appropriation bill. So this was Senator Kimes' bill, and you rolled into it Representative Madigan's bill, which was LD 283, and I can't remember the number of the other bill, but it was Representative Millett's bill. And this is adding in, eliminating the wait lists for 18, 19, 20, 21, 63, and something else. We will find it as we go along. So it does state, and you have seen most of this fiscal information before because you had preliminary fiscal notes for those 2 bills. I think it was 878. So it has positions because it does require positions in order to clear the wait lists. There's the 21, and you can see there's a bunch of different pieces because, as you know from working the change package, there's a number of different accounts that it comes out of. So there's 21, there's 29, there's 63, which is a state funded program. These numbers get quite large, as you can tell. It's more in the second year than the first year because of the rollout. 21 and 29, 18, 20. This is another account for all of those 18, 19, 20, and 21, 29 positions. Oh, that ignore that part. So when you go, oh, and I wanted to show you just at the bottom, this is the summary. This is why you get to see the numbers twice. It's just to show you that it clears the wait list for 18, 20, I'm sorry, not 19, 18, 20, 21, and 29, and then 63 and Chapter 11. So those are the 2 state-funded programs that relate to the elderly, consumer-directed and not consumer-directed. And maybe there wasn't Representative Madigan's bill. I've forgotten now. I'm sorry. And then when you go all the way up to the top, there's the fiscal note. So that's a nice big one for you. It costs a lot to clear wait lists. I mean, you know, you were expecting a big one. And so I wanted to show you that because that's also ready to go. And I do want to point out, actually, you know, we don't have the rates bill yet because it got drafted after the waitlist bill, but the waitlist bill is based on existing rates. And there's nothing we can do about that. You know, I know that you want them as a package, but what I'm saying is if your rates bill were to go forward, that one actually goes up further, but we can't do fiscal notes that way. We can only do what we have based on current law. So that's what it is on existing rates.
Got it.
So that's what I have for you today. I've been pinged all day, maybe Erin has too, with fiscal notes and amendments coming back that are sitting on my desk. So I expect that we'll have quite a few more for you tomorrow to review as well, which is great. Getting them out is awesome.
We all like that. So I don't think as a committee we have too much, we don't have anything else to do right now. I think chairs, leads, and analysts are going to meet at, let's make it 3:15. Is that okay? Senator
Yeah.
Moore?
It should. I've got a work session that starts at 3:30 on one of my bills, but I think I'm second. I'm not sure what order it's going to come up at.
Okay.
We haven't got much to schedule either, Senator Moore, so there's
We
that.
should be relatively quick.
Okay. All right.
If it's a long meeting, we're in worse shape than I thought we were.
We've found some bills somewhere, right?
We got reference one today.
Yeah.
Ah,
And
another one.
committee Democrats will caucus for the third time today at 4:30.
Look forward to seeing your smiling faces yet again.
Always.
And don't forget we start at 10 tomorrow now, not 9:30.
10 instead of
Yeah.
9:30.
Yeah, we goofed up on the scheduling when we set up 9:30. So 10 o'clock tomorrow morning, entertain a motion to adjourn till then.
So moved.
Thank you, everybody. All those in favor.